Vitamin D deficiency is the most common nutritional deficiency in the world, period, hands down.
It's a worldwide problem. There are over, according to the New England Journal of Medicine, Dr. Michael Hollick's study, there are over 1 billion people that are vitamin D deficient in the world.
This is a very important graph here. This is looking at vitamin D levels. We looked at 195 patients and we looked at the vitamin D levels. This is African American females. In our unit in sunny Atlanta, the average vitamin D level for African American females was 9.58. So the government says 30 is normal. That's nowhere near 30. This is in sunny Atlanta because people don't go outside due to air conditioning. It's hot, it's humid. So they have very low vitamin D levels. In our ICU, we found that 98.8% of all our patients were vitamin D deficient in sunny Atlanta. 98.8. Only 1.2% had a level 40 or greater. So African American males had a level of 11, and Caucasian Americans, Caucasian females around 17 or 18. So when you start getting around 17 or 18, you kind of got enough vitamin D to kind of fight off a little infection. But if you notice, the lowest vitamin D level, the African American females had the highest mortality rate here at 14.6%. So after we start rapidly getting the vitamin D levels up, we've lowered our mortality rate for all groups to the same, about 4 to 5% now. So we don't have those high mortality rates because in the past we had a septic African American female that just didn't respond to antibiotics. So basically our mortality rate is decreased basically by just getting people's vitamin D level up. Also, this is very important for physicians. Lowest vitamin D levels, African American females, average ICU costs $43,862. So low vitamin D levels associated with high mortality rate and high ICU and high hospital costs. Okay, what we know now is 80% of the people in the United States are vitamin D deficient. There are about 320 million people in the country, so most of us are deficient. 80% of hospitalized patients are deficient. 80% of nursing home patients are deficient. Level drops 20 to 30% in the wintertime. And as I said, from late October to March, you can make 0 vitamin D. So vitamin D is safe, is cheap, and is effective. I hadn't seen anybody that has allergic reaction to it yet. So that line should be drawn from Atlanta through Phoenix, and that's showing you that all the gray area that in the wintertime you can't make any vitamin D. I've actually seen patients in Los Angeles that were vitamin D deficient. I've had people from Miami that are vitamin D deficient.